Hey there. Sorry, didn't see you earlier. So, how are you doing? Okay, that's great. So I presume you have been booked in for a cranial nerve exam. Okay, great. Yes, you're just in time. Actually, way earlier than usual. Actually, yeah, you're my very first patient for today. It's still morning and the sun is rising. So yeah, let's get it started with you. So, is there any particular reason for your visit today for me to perform a cranial nerve exam on you? Have you ever been to a cranial nerve exam before? Well, to briefly explain it, just a series of tests to make sure that all the nerves, mainly the cranial nerve ones, are intact. Yeah, are working properly, indeed, in the normal condition. So for that, I guess we can get started. So first, we're gonna check your sense of smell, the so-called olfactory nerve. So I want you to close your eyes, so you don't see what I'm going to give to you. So we're gonna test your smell. For that, I'm just gonna spray it around your nose and face, and you're gonna identify the smell from you. Okay. So yeah, have a smell and take your time to give me the correct answer. Okay. Yes. Very good. That was lavender perfume. Okay. Next up, we're gonna use this small tube. For that, I want you to close your eyes once again, but this time stick out your tongue, open up your mouth. Great. Excuse me, let me just open this real quick. Okay, good. So I'm just gonna drop a few drops on your tongue. Just a few drops. That's it. Okay. So what did you taste? Yeah, that was raspberry. Correct. Very good indeed. So now that we have checked your sense of smell and taste, I can confirm that those nerves are indeed intact, and there's no need to check them additionally. So okay, so now what I'm gonna do is I'm just gonna have a look over your facial muscles. This is where I'm gonna be checking the facial nerves and just see if they're working properly. Right. Have you ever suffered any kind of injuries in the past around your face, perhaps the temples or the jawline? You can't tell, or okay, you can't remember, right? Just gonna have a look around your forehead and your eyebrows like that. Could you just wrinkle up your forehead like that, and let me push down, Wait, hard, okay. Okay. Let's have a look over this cheek. Alright. Now, I'm just gonna have a look over your nose till your head up. So I can check the nostrils. That's it. Perfect. Alright, can you just show me a T like that? Okay, now open up your mouth and say ah. Say ah. Let me just have a look over your mouth. Inside of it comes the throat. Alright, looks pretty good. Okay, now if I feel around the temples, do you feel any difference between the two sides? No? Okay. Now, I'm gonna touch it, and from each side, you're gonna tell me left or right. Okay? Good. aligned. Let me just check for any lump. Okay, that's good. Now, what I'm gonna do is I'm gonna test your optic nerve now, which is one of the more important nerves. Not that the others are lesser, but this one is just a longer test to perform on you. Okay. I want you to look at my fingers. When you look at my fingers, you see them, right? Okay, look straight ahead now and tell me which one is wiggling. Okay. Good. Very good. Okay. Gotta get closer to you. Good. Yes. Nice. Okay. Perfect. All right. Count the fingers for me. Good. Okay. Good. Now, watch my finger. Whatever it goes, keep your head still. You know what? I'm just gonna hold it for you like that. Okay. And I want you to follow this one now. Good. Now I'm gonna inspect your eyes with this flashlight. Look up to the sky for me. Look down. Alright. Alright, look to the side. Now look to the side. Okay, one more time, look up. Look up to the sky and hold it for a few more seconds, for a few extra seconds. Good. Now look down. And try to blink as fast as you can. Okay, that's good. Alright, now keep your eyes open for a few seconds. Okay. That's good. Now follow my finger and ignore the light. Now follow the light and ignore the finger. Good. Now, when you don't see the light anymore, just give me a sign. Okay. Good. Nice. All right. Now, when you see it, actually, as soon as you see it, just give me a sign. Okay. Okay. Nice. You see? Good. All right. All right. Great. That's perfect. I'm gonna just perform free movements with my flash light. I want you to continue looking straight ahead. Continue looking straight ahead. That's good. Just keep going. Are you feeling this not too bright for you? Okay, that's great. You see it? You see it again? And again? And again? Again? Okay. That's awesome. Now, I'm going to tap with this really gently around your body. Don't feel anxious or too weirded out by it. I'm just going to check for any tenderness or excessive pain around your muscles. Okay. How does that feel? Okay, good. Now, here, around the chest. Okay, that's it. Alright, now, I want you to put your arms like that and don't let me push them down. Don't let me push them down. Okay, now, shrug your shoulders and don't let me push them down again. Alright, now, close your eyes really tight as if you have self in the middle. Okay, good. Now, I want you to place your place your hands like that, as if you're holding an object. Do it like that, alright? I'm gonna tap on those hands. Don't let me push them down like that, okay? Okay, that's good. Now, I'm just gonna have a look over your posture and overall your head. Okay, that's fantastic. Yeah. I'm gonna use a Q-tip in this side of the hammer. I'm gonna touch your face gently. You're gonna tell me if you feel it's pointy, sharp, or soft. Okay, that was soft. That was pointy. Soft. Pointy. One more time. Okay, that was the soft. Great. Let me just have one last look of you by checking your ears. I want you to hold still. Okay. Just relax. Alright, do you hear this? No difficulties hearing. Okay. How about here? Alright, this is good. Well, I guess that pretty much is gonna be with this cranial nerve exam. We've checked all your nerves, well, at least the main ones, and I can confirm that I haven't found anything that could alarm my attention. We've checked your olfactory nerve, your sense of taste, they seem to be working fine. We've checked your facial muscles, your eyes, your body muscles, your sense of touch, and I haven't found anything specific about you. Yes, that's pretty much it. You're more than welcome, and well, I hope you enjoy the rest of your day. See, bye.